Hi, I'm Dr. Kivett in Santa Rosa, California, and I'm board certified in plastic surgery and dermatology. And I have extensive experience in hand surgery, having had a fellowship with two physicians, one an orthopedic surgeon and one a plastic surgeon, whose practices were solely devoted to hand surgery. I've done thousands of hand cases before, and I wanted to share some things with you today. I had the opportunity, after having lived in South America and practiced there briefly for a year or so, and then as a civilian contractor to the Saudi Arabian Air Force for 3 years. And I was so struck by people that I couldn't help, especially young people, that I decided, with the acquiescence and support of my wife, to go back and get 80 additional years of training. Those 8 years were long years, but it was very satisfying to me to accomplish that so that I could do repair on birth defects and trauma deformities of the hands and fingers and other areas. So I've had the opportunity since then to go to Mexico many times, uh, South America, Philippine Islands, and to work on the details of hand and arm problems, among other things. The various problems that come about are present in small degree or in huge degree and everything in between. Children have a tough time of it as it is, and so they're always looking for improvement, for function if something's not working well, much less appearance. And function usually takes precedence in their mind over appearance, although children seek social acceptance. And here's a question for you: how many fingers does Mickey Mouse have? And while you think about it, and while Walt Disney's artists and cartoonists figured it out, Mickey has one thumb and he has three fingers. They seem to work just fine. And it worked well for the cartoonists, and so that's where they left it. So if children can have a functioning hand and have the grasp of some of these fingers against the thumb to be able to grab onto things, that's way over 60% of the hand function in itself. Some of the common problems that we see on these trips are syndactyly, meaning dactyl means finger, syn means connected. So you'll have people with fingers that never did lose the connections between the bones as the tissues broke down. And so they have fingers that have a variety of appearances where they're sealed, and the patient is best helped in their future existence by separation at least of some of those. There are certain genetic syndromes such as Apert syndrome and just basic syndactyly cases that are not associated with other genetic syndromes. Also, people can have multiple fingers. They can be missing a thumb but have six fingers, but all fingers and no thumb. They can have extra portions of a thumb. So instead of having one thumb, they have two thumbs, which is not usually really two full thumbs. It's more like a thumb and a half, almost like a parasitic piece of a thumb attached to a thumb that works well or not well. Uh, People can have constricted webs so that they have more of a mitt than they do a set of fingers that can be separated. People can also have a cleft hand so that not only are they separated fingers, but the cleft goes all the way down into the palm. So they basically have like a double hand, if you will. And so for them to be able to pick up coins and put them in their pocket, they can't hold them in a palm, which is divided in two. The coins fall out. Plus, imagine the social acceptance. Uh, there are cases of constriction around fingers and around wrists and forearms and upper arms, and constriction within the womb of these protein tissues that are floating in the amniotic fluid that surround other areas, for example, ankles, other limbs, even the neck. And so from the simple constrictions around a finger to the ones around the neck, which of course are fatal, then the less affecting ones can be corrected. So what the effect of the tissues moving back and forth in what's called a Z-plasty or W-plasty will eliminate the constriction at some improvement in the volume of the area so that blood can get in, and importantly, the blood and lymph fluid can get out, and so the person will have a better function over time. Some patients are born with no thumb at all, or they're born with a thumb that is rudimentary, and which the French called pouce flottant, and so it was a barely useful digit at all. Part of the solution for this is to either move the index finger, rotate it around, and have the index finger now become the opposing thumb for the remaining three fingers, which actually works quite well, or a commonly done procedure involves taking one of the toes, particularly the great toe or the second toe, and dividing that from the foot and connecting the blood vessels up and the nerve endings and the bones and creating a new thumb, which is called a toe to thumb procedure, to help those problems. One technique that was developed over time was related to some of man's inhumanity to man, in that children in Liberia were punished with hand amputations at the mid-forearm on both limbs. And when the Russians were in Afghanistan and dropped little toys down that were cute and were attached to bombs so that a child would pick them up, and then both hands would be blown off. So a procedure called the Kruckenberg procedure was developed, in which someone who had at least some remaining bones, namely the ulna bone and the radius bone, were then treated to transfer of some muscle to one bone and transfer of muscle to the other bone, so that they now had kind of a crab claw kind of apparatus where the end of the bone, wherever it was for the most part, in many cases, still imbued with sensation, so that with some training, these young people could be taught to clamp onto things. And so I've not performed them, but I've seen the procedure, and at the meetings, one of the doctors very kindly brought several people from Asia to the meeting and showed how they can have meaningful employment because the ends of the bones were so sensorily imbued that they could pick up small coins, they could type, they could hand things to people, they could pick up small items, big items, and so they adapted over time with the Kruckenberg procedure. So the very satisfying part of dealing with hand problems comes from hand deformities. And this is something that we continue to do in Mexico and other places. It's encouraging. And these people that have the treatment benefit. And so a young man or woman who has a problem as a young person can expect to grow up and have their parents reassured that as adults they will be able to earn a living for their family, raise a family, keep a household, and in general enjoy just about all of the benefits that come from living a good life. If you've enjoyed this discussion, please share it with people and friends and family. Leave us a comment, leave us a question, give us a thumbs up, and as always, if you could subscribe to this channel, it allows us to continue to provide educational information to people who may need it. Thanks for listening.